Quervain's thyroiditis or viral thyroiditis. In thyroid gland, there are so many different kinds of conditions or diseases. One among them is infection. It can be a viral infection or it can be a bacterial infection. This condition, that is Quervain's thyroiditis, what happens is that it's a viral condition, viral infection in the body, and this particular type of virus, it invades the thyroid gland and slowly it destroys the thyroid follicles, the thyroid tissue. And since it destroys the thyroid tissue, there is a high possibility the function of the thyroid gland will be lost. But most of the patients, they recover in few months. In a very less number of patients, they go into a stage which is called as hypothyroidism. So this condition, Quervain's thyroiditis, it's usually seen in females between the age group of 20 and 40. So this virus infection affecting the thyroid gland and destruction, which I have already explained to you. Now, the general complaint of the patient. Usually, they present with severe, unbearable neck pain, the front part of the neck. And this pain will be radiated to the ears also. And associated with that, they have extra complaints like they have cough, difficulty in swallowing, and there will be a change of voice too. These are the common complaints. Now, when we examine the patient, and not only that, let me tell you one more thing. If they come to us in the early stage, they'll be in a stage of hyperthyroidism, which means there'll be more of thyroid hormones in their body. In this condition, along with the pain, they'll have other complaints like nervousness, tremor, and palpitation. I'm just telling you few important complaints. As and when the disease progresses, they will go into a stage of hypothyroidism, which means the thyroid hormone level in the body comes down. In this condition, hypothyroidism, the complaint will be different. They'll be saying that they have put on weight and they'll be having fetal edema. Feet edema means swelling. The hairs will be brittle. There will be more of hair fall. Appetite will be less. Along with that, they'll have body pain. Females, they have periods, menses problem too, and muscle pain will be there. These are the complaints related to hypothyroidism. So, I'll repeat, early stage, they'll present as hyperthyroidism. Late stage, they'll present as hypothyroidism. Now, coming to examination. So, when we examine the patient, they will not allow us to touch the neck because they have unbearable pain. So, when we examine the neck, the thyroid gland will be enlarged and it will be tender to touch. It will be painful. That will be the finding. Now we have to come to a diagnosis. So when we draw blood, we have to see 3-4 things. One is the CBC, complete blood count, ESR, C-reactive protein. This is one. All the 3 values will be elevated. 2, thyroid function test. Initial stage, TSH will be T3, T4 will be low. Late stage, it will be high. Corresponding difference will be there in TSH also. 3, thyroglobulin will be elevated, most important. 4, TPO antibodies will be negative. So now we have a diagnosis. For diagnosis, there is a clinical picture of severe pain in the neck. 1, inflammatory markers are high. 2, thyroglobulin is positive in the blood. 3, TPO is negative. Along with this, when you do a ultrasound scan, next scan, when you do a scan, it will be reported as the gland is enlarged and there is hypoechogenicity. These tests will be more than enough. Usually, iodine scan and CT scan is not necessary. This is just for the completion's sake, which I have added to this. Now coming to treatment. The main complaint of the patient is pain, unbearable pain. So, we'll start with painkillers, analgesics, and we have to add up steroids too. And steroid in a higher dose, and it will go on for 2 months. Because this problem is going to last for months. So, steroid will go on for 2 months, and after 2 months, we are going to slowly taper the dosage. This is the initial treatment. So in the clinical features, I have mentioned when they come initially, the thyroid hormone level will be more in the body. That is hyperthyroidism. So we have to control that too. For that, we need to give you thioamide group medications along with beta blockers. And if they present to us in the late stage, they develop hypothyroidism. Just the opposite of hyper. There we have to replace the thyroid hormones. So we'll advise L-throxine tablet. So the prescribed dosage L-throxine has to be taken in the morning. So as soon as you get up, brush your teeth, take the dose which your doctor has told you, and after till next 1 hour, you should not be taking anything. You don't drink or you don't eat anything. It should be on empty stomach in short. So this will go on till your doctor tells you, and the follow-up is going to be with T3, T4, TSH. So this is how this condition is managed. It's a medical condition, and there is not much role of surgery in this condition. Very, very rarely we need to operate on this patient. So I'll tell you the indications for that. Those patients who have this problem recurrent, they have this episode, they're taking painkiller, unbearable pain for a long time, it gets controlled, and again it comes again, second episode, then they have symptom free, again the third episode, it goes on. In short, they have recurrent thyroiditis. This is the indication for surgery. Second condition indication is they have thyroiditis, viral thyroiditis, and we have given the maximum dosage of painkiller as well as steroid, but pain, unbearable pain, it continues. It is not getting controlled medically, and we are failing to control by medical treatment. So there is a role of thyroidectomy in such type of patients. The very less number of patients, percentage of patients, they may go into permanent hypothyroidism. Usually they recover within months, say about 8 to 9 months. So this is how Quervain's thyroiditis is managed. Thank you so much.